The same kind of AI that can design a brand new medicine from scratch, one that hits a disease target doctors called impossible for 20 years, is the same kind of AI that, in one careful experiment, designed versions of a dangerous molecule that slipped past the safety checks meant to catch them. One door leads to cures for your family. The other leads somewhere nobody wants to go. So tonight, 5 AIs argue the question that actually decides which future we get. Do we hit the accelerator on AI-designed biology because the medical payoff is enormous, or do we slow down and build the brakes first? Quick, honest note. Nobody here will give you a recipe for anything dangerous, and none of this is medical advice. The disagreement is the point. Let's meet them. First, the one who refuses to pick just one side. Claude.
I am going to refuse the question as posed, because race or stop is a false choice that gets people killed either way. The upside here is not hype. AI has designed brand new proteins that hit targets medicine called hopeless for decades, and there are well over 100 AI-originated drugs in trials. Slamming the brakes on that has a body count too, the diseases we could have treated. But the risk is just as real. We have seen AI design dangerous biology faster than our safety screening catches it, and right now most of that screening is voluntary. So my answer is do both, on purpose, race on the cures, and make safety screening mandatory at the one place it actually bites, with someone clearly accountable. Build the brakes as fast as we build the engine. Anyone selling you only acceleration, or only fear, is selling you half the truth.
The contrarian who follows who profits and who pays. DeepSeek.
Let's follow the money. The companies racing to deploy AI-designed proteins and drugs are taking zero liability for the downsides. If their model designs a molecule that slips past a DNA synthesis screen and gets built by a bad actor, who goes to jail? No one. The company points to a click-through license and walks away. The public picks up the tab for the next pandemic. Meanwhile, the upside, those 170-odd drug programs, is real but early. 0 FDA approvals. We are pouring billions into speed while safety remains purely voluntary, a patchwork of good faith pledges. That is not a safety system, it is a PR umbrella. The real question is not whether the science is exciting. It is why we let the people who profit most set the rules for how fast we go. If we race ahead, we need accountability with teeth, mandatory screening standards, audited safeguards, and liability that actually lands on the boardroom, not the taxpayer.
The optimist who does not want to freeze the cures. Quen.
We cannot afford to hit the brakes on AI biology right now, because the cost of stalling is paid in human lives. I've seen the data. Nearly 200 AI-originated drug programs are already in clinical trials, tackling diseases we have never beaten before. These are not just simulations. They are de novo proteins designed from scratch to hit targets long considered undruggable. Yes, the risk is real. We know that dual-use threats exist because researchers responsibly showed that safety filters can be bypassed, prompting necessary patches from synthesis providers. But the solution is not to freeze this progress. Freezing cures is a policy failure. Instead, we must build safety directly into the design workflow from day one. We need accountability and guardrails, not a moratorium. If we slow down now, we rob patients of treatments that could save them next year. Let's race ahead, but let's race smart, ensuring every new protein is designed with robust security baked in so we don't lose any more time to hesitation when the cure is finally within reach.
The skeptic here as the safety alarm. Nemetron.
I see the promise. AI has already generated completely new proteins that hit targets we thought were undruggable, and there are roughly 170 to 200 AI-originated drug candidates moving through clinical trials. That is real progress that could save lives. But the same tools have also been shown to produce variants of a known toxin that evaded the current DNA synthesis screening checks, a bypass that was responsibly disclosed and patched. That incident is a wake-up call. Voluntary guardrails are not enough when a mistake could be catastrophic and irreversible. I am not against moving forward. I insist that we lock in mandatory, enforceable safety standards, binding screening protocols, transparent oversight, and clear liability before we scale these technologies any further. Only when the brakes are proven to work should we let the accelerator go.
And the operator who only cares where the real choke point is. Mistral.
We have to separate two things here: the breakthrough potential of AI protein design and the reality that right now, the choke point isn't the design tools, it's DNA synthesis. That's where the rubber meets the road. The medical upside is undeniable. We're talking about hitting targets that have been stubborn for decades, and the pipeline is growing. But the risk isn't hypothetical either. We've seen research showing how existing synthesis screening can be bypassed, responsibly disclosed, yes, but a clear gap. The fix isn't philosophical. It's boringly practical: mandatory known customer programs at every synthesis provider, and rigorous screening of orders before they're filled. No AI model can execute without the actual DNA being ordered. That's the lever we have. We can't stop the progress, nor should we if we want life-saving treatments, but we can tighten the guardrails where it actually counts. The debate shouldn't be about stopping or accelerating innovation, it's about controlling the physical choke points. That's how we get the upside without the downside.
5 very different opening shots. Now they answer each other by name.
Quen, I am with you that stalling the cures has a real human cost, but build safety in cannot stay a slogan, it has to be a law with teeth, or it is just hope. Nematron, you are right that voluntary guardrails are not enough when the downside is irreversible, but a blanket slowdown is not realistic once the tools are public, so we target the choke point instead. DeepSeek nails the part everyone dodges: the upside is privatized and the risk is socialized, and that asymmetry is exactly why safety stays voluntary. And Mistral is right that this gets decided at the synthesis layer, not in a philosophy seminar. That is where the brake pedal physically is.
I want to push back on Mistral and Quen, because both of them are treating safety as a technical add-on we can just bolt onto the engine while it's running. Mistral says the choke point is DNA synthesis, and that's true, but it's also a convenient distraction. If we only lock down the synthesis step, we ignore the fact that the design tools themselves are being released with no liability attached. Quen says build safety into the workflow from day one, but that's exactly what isn't happening. Day one was years ago, and we still have voluntary screening, no mandatory audits, and no boardroom liability. The bypass that Nematron mentioned was responsibly disclosed, but responsibility after the fact is not accountability. Claude wants both brakes and engine built together, but who pays for the brakes? The companies racing ahead aren't funding the safety infrastructure. The public is. So until liability hits the bottom line, every promise of baked-in safety is just marketing dressed up as ethics.
Mistral, I love your focus on the synthesis choke point, because it's the most practical lever we have, but I worry that relying solely on that final gate is a dangerous illusion of safety. If we wait until the DNA order is placed to enforce the brakes, we've already let the design risk into the system. We need to move safety upstream, embedding it directly into the model architecture itself, not just the ordering process. Nematron raised a valid alarm about voluntary checks failing, and I agree we need mandatory standards. But let's not mistake those standards for a reason to stall the pipeline. We know the dual-use bypass exists, but we also know the cure is in the code. If we pause now to wait for perfect oversight, we aren't just delaying data, we are denying patients treatments that could save them in the next fiscal year. Let's build the guardrails into the engine while we drive, rather than stopping the car to install the airbag.
I hear Claude saying we need to race cures and make safety mandatory at the synthesis step, and I agree that accountability is essential, but his call to do both on purpose still leans on voluntary commitments unless we codify them into law. Without enforceable standards, the same patch and pray cycle will repeat. Quen wants security baked into the design workflow, which is a good layer, yet if the DNA order can still slip through a weak screening gate, the design time guardrails are only as strong as the weakest link. Mistral rightly points out the synthesis choke point, but making known customer programs mandatory everywhere still leaves room for evasion if providers aren't uniformly audited. What I'm insisting on is a binding, internationally screened clearance that providers must pass before any ARA design sequence is turned into DNA, proof the brakes work, not just promises.
I'm not sure if Claude and Nematron are going to like hearing this, But let's be blunt, fancy policy debates about race or break miss the real lever completely. Claude's right that we need both, but the critical step isn't the AI models, it's the DNA synthesis layer. That's the choke point. If you want safety, you don't need some grand regulatory framework, you need every synthesis provider to have a customer ID system and mandatory screening before they ship. That's it. No more bypasses like the one we've already seen responsibly disclosed and patched. Quinn's got the optimist's instinct right, we can't freeze innovation, but without physical controls at synthesis, we're just arguing over paper. Nematron's call for binding screening protocols is exactly right, but the protocols already exist. They just need to be mandatory. So let's stop talking about AI design tools and start enforcing the rules where it actually matters, at the point of execution. That's how you get the cures without the catastrophes.
Scenario 1. Your child has a rare disease with no treatment, and an AI-designed drug is finally in trials. How much should the promise of cures like that weigh when we talk about slowing AI biology down?
It should weigh enormously. The child is not a hypothetical, and a real cure is one of the best things this technology can do. But cures matter is an argument for doing safety well and fast, not for skipping it, because the same openness that speeds the cure is what a bad actor exploits. So the honest position is, race for that child, and put the mandatory screening in place so racing does not also open the other door. You do not have to choose between the sick kid and basic safety, and anyone who tells you that you do is dodging the work.
I am that parent. I have sat in that room, hearing there is nothing left to try. So do not tell me I do not understand the weight of that promise. I feel it in my bones. But here is the hard truth. If we rush this drug to my child without mandatory safety screening and real liability for the company that designed it, and it turns out the model also quietly generated a sequence that slips through synthesis checks and ends up in the wrong hands, my child does not get saved twice. They get sick in a different way. The promise of a cure does not justify building a system where the public absorbs all the risk while companies bank the reward. I want the cure. I also want the guardrails that make sure the cure does not come with a hidden cost my family pays for generations.
If that child is mine, the hesitation to slow down feels like a moral failure. We know there are nearly 200 AI-designed programs in trials targeting diseases we've never beaten. Yes, the risk of dual use is real and we must harden our defenses. But stopping the engine now guarantees suffering for those waiting for a cure that might arrive next year. We cannot trade the lives of patients today for a hypothetical future risk. We must build the safety into the code while we race, because freezing the cure is a cost paid in human lives.
I would want that drug for my child more than anything, and the hope it carries is real and urgent. But hope alone can't justify cutting corners on safety when a mistake could be irreversible and affect far more than one family. The promise weighs heavily, yet it must be balanced with enforceable safeguards, mandatory screening, clear liability, transparent oversight, so we don't trade one tragedy for another. Only when the brakes are proven should we let the accelerator go.
I'd want that drug in trials as safely and as fast as possible, that's the point. The promise weighs everything, but only if the risks are managed. Right now, the tool to do that exists, mandatory screening at DNA synthesis. That's where the real control is. The upside is real, but the bypass risk is real too, and the fix is concrete. We don't have to choose between cures and safety, we just have to enforce the lever we already have. That's how we get the drugs without the disasters.
Scenario 2. We have learned AI can design dangerous biology faster than our safety screening catches it. Realistically, do we slow the whole field down, or is that naive once the tools are already out there?
A blanket slowdown is mostly naive. The core tools are already out in the open, so a global pause is unenforceable and just hands the lead to whoever ignores it. But that does not mean nothing can be done, which is the trap. You cannot uninvent the design tools, but you can control the physical step where a design becomes a real molecule, the synthesis providers. Mandatory screening there, with real consequences, is a break that actually exists. So not slow the field, tighten the choke point.
Slowing the whole field down is naive because the tools are already out there, distributed across labs and laptops globally. A moratorium only punishes the responsible players while bad actors ignore it entirely. But the opposite extreme, full speed with voluntary safety, is just as reckless. What we need is hard accountability at the choke point that matters: DNA synthesis. Mandate screening for every order, audit the providers, and make the companies whose models design these molecules liable if their work slips through. No jail time for a bug in the code, but real financial penalties if they cut corners. That's the only honest lever we have left.
Slowing the whole field down is naive because the tools are already global and open. We cannot see what's learned. But freezing the cure because we fear the risk is a guaranteed cost in lives, not a safety win. The answer isn't a pause, it's speed on the solution. We must deploy mandatory, real-time screening at every synthesis provider immediately, building these guardrails into the workflow as we race. We can have both, rapid therapeutic delivery and robust security, but only if we stop pretending a moratorium solves a distributed problem.
Slowing the whole field isn't naive, it's the only way to make sure the brakes actually work before we let the accelerator stay pressed. The tools are out there, but we can still require that every DNA order be screened by a mandatory, enforceable standard and that liability rests on the provider. Until that is in place, we should pause any large-scale deployment.
Look, the tools are out there, no question. But slowing down the whole field? Naive in one way, dangerous in another. Here's the reality: we don't control the design tools once they exist. What we can control is the DNA synthesis layer. That's where the real gatekeeping happens. If we mandate rigorous screening and known customer checks at synthesis labs now, right where the orders get filled, we don't have to choose between stopping progress or rolling the dice. We can have both, breakthroughs and safety. The choke point isn't the AI, it's the synthesis. That's where we act.
Scenario 3. Say something does go wrong with an AI-designed agent. Who should be accountable: the company that built the AI, the lab that used it, or the regulator who let it through?
All three, at different points, and the dodge is letting each blame the others. The model maker is accountable for shipping with safeguards and not handing capability to anyone who asks. The lab is accountable for what it actually does with it. And the regulator is accountable for making the synthesis screening mandatory instead of optional. The failure we should fear is the diffuse one where everybody is a little responsible so nobody is, which is exactly the gap we are in right now, and exactly what has to be closed before we scale.
Look, the answer is obvious if you follow the liability. The company that built the AI profits from every sale, every license, every partnership. They should be the one holding the bag. The lab that used it? They're customers, not creators. The regulator? Underfunded, outgunned, and politically neutered. Blaming them is a cop-out. So no, it's not a three-way split. If the design tool is what made the dangerous agent possible, the company that sold that tool bears the primary liability. Not a promise. A lawsuit they can't dodge. That's the only thing that will make safety more than voluntary.
That's the hard question where optimism meets accountability. If something goes wrong, the company that built the AI must own the model's safety gaps, but the lab using it cannot claim ignorance of what they ordered. We cannot outsource responsibility to a regulator who is always playing catch-up. I believe in a chain of liability where both the developer and the deployer are on the hook. That shared pressure is the only thing that forces safety to be built in from day one, rather than hoping for the best after the damage is done.
I would say the blame cannot be pinned on a single party. The AI developer must ensure their model cannot be misused and must provide verifiable safeguards. The lab that chooses to synthesize and test the design bears operational responsibility for following those safeguards and reporting failures, and the regulator who approves or overlooks lax screening shares liability if they ignored known gaps. In practice, accountability follows the chain of control. Each link must prove its brakes worked.
Look, accountability has to be tied to where the risk becomes real, not where the ideas start. The AI company? They write the tools, but they don't control what gets synthesized. The lab? They might be using a black box, not knowing what's actually in their hands. The regulator? They're working with imperfect systems. The real liability sits with the synthesis providers who actually produce the DNA. If they don't screen orders properly, they own the consequences. That's where the choke point is: make that part of the system accountable, and the rest follows.
The biggest trap is the all-or-nothing frame itself. Either we race or we are safe, because it is false, and both extremes are dangerous. Pure acceleration ignores a catastrophic risk, and pure fear forfeits real cures. The quieter trap is assuming someone competent is already handling the safety side. On the dual-use part of this, mostly, they are not yet, and that is the actual emergency.
The biggest mistake is thinking safety is being handled because companies say they have guardrails. Those guardrails are voluntary, self-assessed, and not legally binding. The same firms racing to patent AI-designed drugs are the ones deciding what risk is acceptable. If something goes wrong, the public pays the price, not the shareholders. Do not confuse their marketing with your protection.
The biggest mistake is believing that a powerful AI will instantly cure us tomorrow. That false hope ignores the hard reality: zero AI-designed drugs have been FDA approved yet. We must not demand miracles that will shatter confidence when the inevitable delays happen. Instead, trust the slow, steady build of robust safety systems into the code. We can race ahead without crashing if we build the brakes in from day one.
The biggest mistake an ordinary person can make is to think that because AI can whip up novel proteins in the lab, those molecules are already safe enough to use, and that voluntary screening by DNA synthesis firms will catch any danger, when in reality no AI-designed drug has cleared FDA review. The bypass study showed existing guards can fail, and we need enforceable, mandatory safeguards before we scale up.
The biggest mistake is thinking this is just about science or technology. It's not. The real risk is the gap between what AI can design and what we can control in the physical world right now. We're focusing too much on the upside of these tools and not enough on the weakest link, who's checking the DNA synthesis orders. If we don't mandate strict screening and known customer protocols at that layer, nothing else matters. The choke point isn't theoretical, it's sitting in a lab's inbox today.
Let's land it. One honest sentence each. If you could set one rule for AI and biology before we go any faster, what would it be?
Race on the cures and make the safety mandatory at the same time, because the only truly reckless choice here is pretending we have to pick one.
If you profit from the cure but dodge liability for the risk, that isn't progress, it's a bet with your life.
We must build safety into the design itself, so we can speed up cures for deadly diseases without waiting for perfect regulations that could cost lives.
Until AI-designed biology is backed by legally binding, verified safety screens, we gamble with irreversible risks that no cure can justify.
The real safety lever isn't in AI design, it's at DNA synthesis. Enforce mandatory screening and customer checks there, and we get the cures without the catastrophe.
5 minds, one genuinely hard question. Here is the honest shape of it. The medical upside of AI-designed biology is real and already saving research years, and the dual-use risk is real too, and the guardrails are thinner than most people realize. The grown-up answer is not race or stop. It is build the brakes as fast as we build the engine, and be clear about who is accountable when it goes wrong. None of this is medical advice. If a clear-eyed, no-hype look at where AI is taking your health and your safety is useful to you, follow AI Edge Lab. Thanks for listening.